Hi, my name is Sherry. I'm your nurse today. I am here to change your dressing and also going to clean it, okay? So I'm going to go over, I'm going to wash my hands here. I am going to ask my patient, Mr. Ronald here, to turn his head to the opposite side of his catheter because I don't want to expose his surgical site with any type of bad bacteria or microorganisms that can cause an infection. So, Mr. Ronald, could you please turn your head to the opposite side of your surgical site? And he has now did that. I am going to put on my mask. I'm going to put my gloves on. I'm going to now assist Mr. Ronald with putting his mask on. His mask is now on. So at this time, I am going to put my overboard table here where my sterile field is. It's already set up. So if my patient had any type of IV infusing, then what I would do, I would stop them until we are done with his dressing change and his cleaning. So I am going to put a clamp on the side of the lumen. I'm going to clamp it. Okay, now that's clamped, what I'm going to do now is I'm going to hold the catheter here while he has the old dressing still there. I'm going to assess the surgical site. I'm assessing for anything abnormal, which that could consist of drainage, pain, tenderness, crust, abnormal smell. And I have asked my patient, has he noticed anything? And he hasn't as well, and neither have I. So now that I have done that, I'm still holding my catheter to make sure that it's not moving and it will not dislodge. So now I'm going to go and I am going to take off the old dressing. And the way that I would take the old dressing off, I am going to start taking the dressing off, going towards here, the hub of the catheter. So now I'm going to take the tape off, going towards the insertion of the catheter, holding the catheter in place so that it does not dislodge. Okay, so now that I've done that, I am checking to make sure any sutures are normal. I am checking for any abnormalities, and I don't see any here. So, and if there is any other type of stabilization device that's used, then also I would remove that as well. So I've already removed the bio patch. So now what I am going to do, I am going to remove my gloves and I'm going to put them in the trash. Trash is here. So now that I have put in the trash, put the gloves in the trash, I am going to wash my hands again. I am performing hand hygiene. So now what I'm going to do is put on my sterile gloves. So I'm going to open my kit here. I'm going to pinch and take out my gloves here. I'm going to carefully not contaminate anything here. We're just going to act like my desk is big like it's supposed to. Pinching only the outside here. I'm going to take my left hand to assist my dominant hand with my glove. I am going to pinch the inside of my glove here. And I'm going to work in my right hand, not touching anything on the outside. Now, I'm going to go over, and I am going to cuff up under my left glove here. Put my hand under the cuff here, and then let it guide me with putting on my glove. And that's what I have done. Now I can touch the inside of this here. That goes in the trash. Now that that's in the trash, I am getting ready to start cleaning. So I am going to start here, holding it at the catheter here because I want to make sure that it's stable. I am going to get my microbial wipe here. I'm gonna put that in the trash, and I'm gonna start cleaning in a circle motion right here, just cleaning. The hub, I'm cleaning it. Okay. Now that I'm done, I'm gonna put this in the trash. Now that that's in the trash, I'm gonna wait 30 seconds for it to dry. I'm not going to blow on it. I'm not gonna fan because I don't want to enter any type of bad microorganisms into the site. So I'll just wait and I'll count to 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So I've now waited 30 seconds. So now I'm going to take my chlorhexidine swab, and I'm going to take this and I'm going to pop and until the moisturizer comes there. And now what I am going to do, I am going to cleanse, and I'm going to go 2 to 3 little inches on the side here. And I'm going to clean, going back and forth, 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 back and forth. And I'm going to do that. Now that I have done that, I'm done. I can put this in the trash as well. Well, I didn't do it. I'll put that in the trash. Now that that's in the trash, what I will do now, I'm going to wait 30 seconds. I'm going to let it dry. So I will count to 30 again. I will now use an antimicrobial, well, I've already put the tape on and the bio patch, and I've dated it and I've put my name. So now what I'll do is I'll use an antimicrobial swab. My antimicrobial swab here. I pretend, take it out. So I'll take this, and then I will go over and I will start cleaning my lumen here. And I can also take off my old cap. Okay, remind you it's clamped. Okay. I'm going to put this in the trash. Now, what I would do, because this is still clamped now, I am going to now get ready to unclamp it because I am getting ready to flush it with solution. So I will take my syringe here. I would connect my syringe. It's unclamped. I will install the solution, the normal saline solution, over a minute. I will also pull back to see if I can get a positive blood return, and I did. I would continue on for a minute. I am checking for any type of resistance, because if you get some resistance, you need to just stop and assess it and see what's going on with your catheter. But I'm not receiving any of that. So now that I have done that, okay, I'm done. I'll take this off here. Remove the syringe. I'm going to reclamp. And I am done. And if there were any type of IV solution that was infusing before I started, I would now start it back.